Hi there, this is Lori Edge-Hughes, and this is your 4-Leg Rehab Minute. And in today's minute, I want to talk about something that I thought I'd already talked about as a 4-Leg Rehab Minute, but I don't see it. So I want to talk about LickGranulomas. Now, I know I've talked about it in snippets in lots of other places, but let's do a minute. So, a LickGranuloma. So if you've got a dog that is licking or chewing at some spot on itself, and they're usually down by the ankles or the feet, right? So you see this lick marks. Oh. So basically what we're looking at is that patch of skin where the dog is obsessively licking and chewing. It would maybe start off just as porphyrin staining of the hair, but then it could turn into a wound and a granulomatous kind of a thickened wound that the dog just won't leave alone, and therefore it gets worse. Now, typical traditional veterinary medicine looks at and says, what's going on there? Is this bacteria? What is this? And they might do skin scrapings and they might prescribe an antibiotic, but a lot of times it doesn't work. So let's go back into time, as in what it could be. So if we use the Wayback Machine and we go way back to 1995, and this is where I had found, and ages ago it was presented to me as, hey, have you read this? So Stice et al. Presented research findings as a letter to the editor in Veterinary Dermatology. So Veterinary Dermatology 1995, issue 2. And they had noted that in a number of dogs with LickGranulomas, they had a nerve conduction deficit, okay, that corresponded to the dogs with LickGranuloma in 56% of the cases. So 9 out of 16 dogs. This is what they found. So let's talk about that. So you cannot reverse engineer that. You cannot have a LickGranuloma that causes a nerve conduction deficit proximal, okay? But you can have something like a pinched nerve in the cervical spine and of a nerve that supplies the legs, or the lumbar spine in a nerve that then goes down and supplies the rear legs, okay? And that pinched nerve can then result in a nerve conduction deficit. And a nerve conduction deficit might result in, like, if this was a person and they could talk, they would say, oh yeah, I feel pins and needles, I feel tingling in through there. And so in which case the dog feeling that, right, would lick and chew at that area that did not feel normal or right. So the nerve conduction deficit that is proximal causes an abnormal sensation, presumably, because we can't ask them, okay, that then causes the dog to lick or chew and persistently at that area, which then causes a skin reaction, which then is your LickGranuloma. Okay, so if you have a dog with porphyrin staining, okay, and or as much as a LickGranuloma, hair loss, anything like that, always check proximal. So if it's in the rear leg, you check the lumbar spine. If it's in the front leg, you check the cervical spine. Okay, if it's alongside the spine, you check alongside, adjacent to, wherever the hair loss or the chewed on area. I've had a couple dogs with L2 and a little bit of hair loss just right beside there and obsessively chewing at it. So think about nerves. You see licking, chewing spots, think about nerves. That's it. So until next time, cheers.